everybody. Welcome back for River Talk 2.0. You like that? I did a little boy howdy. Let me get adjusted there.
Dr. Jack.
See, I left my CMC mask at home. I washed it.
I know you did.
You got to wash them.
Well, yeah, you got to wash them.
You got to wash them.
And the paper ones are tough to wash.
You don't wash
dry
them.
and iron.
In fact, they're pretty much good for about 4 hours.
Is that right? I've been wearing mine for 4 months. I didn't know that. Yeah, I wonder why it's turning yellow in the middle.
Unbelievable,
yeah,
my
great.
man.
It's hard to press those, isn't it? The
Oh,
paper
yeah.
ones, it's
You
tough to
can't
press.
iron 'em.
You
Yeah,
can't
they
iron.
got those pleats on them.
You can't iron. It's hard to get them pleats straight
Do you
again.
iron your mask?
No, sir.
That's the only thing I don't iron. Yeah. I don't put the crease in the pants anymore.
Well, let me ask you this, Doc. How do you drink coffee through one of these things?
You don't. You don't.
All right, well, then let's hurry and get this interview over. I've got to have some coffee.
There
I
we
hate
go.
to say it, but I mean, I love you and everything.
I appreciate that. Thank you.
That's all right.
This is Dr. Paul Richardson, the big cheese over there at Conway Medical Center.
Morning.
Medically speaking.
Medically speaking.
Yeah.
Yeah. Good morning.
Yeah, good to see you.
Yeah. Good to be here.
Exciting times over there. We'll start with the so-called elephant in the room. We're still wearing our mask.
Yep.
Numbers are going down for cases.
Numbers are going
that's
down for
good.
inpatient cases, absolutely. And also our overall positive rate has gone down pretty significantly over the last several weeks. That's great. I think it has to do with folks wearing these and washing these and doing the right thing. And so I appreciate what folks are doing because it is making a difference. And, we're seeing a dramatic decrease in the number of inpatient admissions. It doesn't mean it's over.
Right.
But it certainly is. It's a welcome relief for all the frontline, all those nurses and docs that are doing just a fabulous job.
Sure.
So yeah, and we've seen our positive rate of the testing we're doing. We were running right at about 20-some% positive. We're now down to single digits.
Okay.
So it's 8-9% positive rate. So that's a very, very good thing, and I think it just has to do with folks doing the right thing.
Yeah. Well, that's good. And some folks that have gone in for treatment, the number's pretty high on folks that came through. And
Absolutely, yeah, absolutely. I mean, we have some folks passed away, absolutely, and we want no one to pass away, but we got to keep in mind a vast majority do survive, and that's what we're aiming for. We're aiming for nobody to pass away. So,
well, change has come. There are more hospital beds in Horry County, and I'm not rocket scientist, but I know as we build more houses, and we're building them, son.
absolutely,
That means
Big
we're
time.
going to need some more hospital beds.
absolutely.
And I'm not going to put you on the spot, but I hear that you guys are trying to address, maybe relocate, reallocate, or what's the plan?
Actually, we are super excited because we have applied for a certificate of need with the state to actually build a new facility over in Carolina Forest off of International. And what we're asking for is to move 50 of our current beds at the current Conway Medical Center over to that facility.
Okay.
And so, because we have a bed count of about 210 is what we're licensed for. We don't use that many beds. We could move 50 and still be in perfect shape to serve the community. And so that's what we're asking to do.
So this going to be like a satellite hospital, but a large satellite
This
hospital,
will be a
right?
fairly sizable satellite hospital. Conway Medical Center, the main campus would remain the main campus. That'll be where where all of our most of our big surgeries go on. Our heart program stationed there. All that's going to happen still there. But this would be a large satellite hospital, but a full scale hospital nonetheless.
So when you say Carolina Forest, what particular area?
Just off International, right there.
Okay.
Not too far from River Oaks on that side. Absolutely, trying to serve that area that we know is growing very fast, and you all know. I mean, it can be a bear to get over from that side back over to our campus, and so we're really just trying to put services where people need it.
Yeah, there's a lot of development there, and that would even serve. I live there just on the other side of the waterway in Myrtle Beach.
Gotcha.
And that would be just as close as some of the other hospitals.
Absolutely. That's really what we're striving for. And we're, like I say, we're looking to. I mean, we're going to have operating rooms, emergency room, labor and delivery. We're going to be delivering babies there. It's really going to be a full-scale hospital. But again, our main campus will remain our main campus.
That's awesome.
Yeah, when do you propose to get underway on this thing here?
Actually, like I said, we're going through the certificate of need process right now. We're awaiting the final word from the state, and then if we don't have any opposition, we would look to occupy the building in about 2024.
Wow.
So it's going to take a few years,
yeah.
a couple years to build a facility of this magnitude.
Sure.
So that's really what we would love to be in there 2024, if not a little sooner, depending on how things go.
That's awesome.
Yep. It's a great news for the community. I mean, that's really what this is about, is serving, our entire community, Conway, Carolina Forest, all this this whole section of Horry County. We like to take care of and appreciate the privilege of doing that. So,
well, tourism is the big industry here, and healthcare does come into play with tourism now.
Sure.
And obviously, when you're talking about folks that retire here and relocate, in addition to schools, what's the healthcare system like?
Mm-hmm.
And you've got a great partner with Duke.
Yep.
I mean,
yes, sir.
That's a huge partnership.
They've been really wonderful partners. As you recall, we're partners in both our cardiac program as well as our cancer program. Is what we're partnering with in them, and through a ton of effort of everybody at Conway and also the folks at Duke, we just recently in the last couple of weeks started doing cardiac stenting, at Conway. And we have had a very successful start, very successful, far exceeding our expectations. And so that's wonderful that folks can now get, heaven forbid you need a stent put an artery in your heart, but you can get it right at Conway Medical Center, and we're doing great work there.
That's incredible. That's in our backyard. I mean,
absolutely.
That helps in the healing process for folks.
You better believe it.
Travel long distance.
You better believe it. And right now with the COVID, and I know visitation is limited, but it's not always going to be that way, right? Mm-hmm. So for folks to be able to be close to their loved ones, if they have to have a stent, heaven forbid you have a heart attack, but if you need a stent, before you have a heart attack, either way, we're able to do those.
That's incredible. That's really, really good.
Yeah. Like I said, we're trying to bring the services that folks need locally. It's a hardship to have to travel, and so it makes it nice to be right here in our community.
Well, whose idea is it to choose which area is a specialty? Kind of like with chest pain. I mean, how's that decision weighed out?
Well, we have national accreditation standards that we have to abide by, and recently we became what's called a accredited chest pain center, and basically through the American Heart Association, what they do is they have very strict guidelines. You have to meet certain parameters. You have to have everyone educated up to a certain level, so that your staff is proficient in taking care of patients, and so we were able to meet all those marks, and we're actually awarded chest pain accreditation here in the last couple of weeks as well. So now Conway Medical Center is an accredited chest pain center. So that we're super proud of that as well. I mean, that's a big deal, and took a whole lot of work and a whole lot of effort, just to be able to make sure, hey, if a patient arrives at the door, you have to certain time before you get an EKG, certain time before you get this. I mean, we have to meet all these marks in order to be able to get that accreditation.
There's an old phrase that a rising tide lifts all ships. As you bring this program in and you have success, that means that the hospital has the potential to grow into other areas.
Absolutely. No doubt about it. I mean, that's what this is all about, is continuing to expand our services, and we're looking to bring subspecialists here that our local community hasn't had before, like rheumatology and some other things, and so we're recruiting that right now. So we really are trying to meet folks' needs and what we see as the needs of this community. Absolutely.
Take out the numbers from COVID. Life expectancy, did it taper off, or has it inked up a little bit in the last few years? It was almost, I think I saw something where it just kind of like.
I don't think there's been a dramatic change, in that over the last few years as far as that goes. Medical science, we've come a long way, though. If you look back, I mean, even the last 30 or 40 years, we've come a long, long way on that. So, and some of ours is habits. We like to eat. We like to eat what we want to eat and that kind of thing. And we still have a fair bit of smoking going on.
Yeah, we got an all-you-can-eat buffet every 2 miles.
Absolutely. Absolutely. So,
I'm like going, wow.
So while that does provide business, it's business that, we could not have. So yeah, but even despite all that, we've come a long way as far as life expectancy and whatnot. And again, like I said, these are the type, as we do age, we're going to need things like, unfortunately, we'll need cancer care. It's great to have world-class cancer care right here. We're going to need cardiac care. I mean, even despite if we didn't eat all we wanted and whatnot. But so it's good that's why we want to bring that here. We do know that we want to take care of our young folks, but we also have a lot of retirees, coming in this area.
I'm glad to hear that.
That need that.
At my age, I'm really tickled to death to hear that.
Well, we'll take care of you. That's
You're
for sure.
a nice man.
I appreciate that. Thank you very much. Yeah, we'll take care of you. Absolutely.
Well, I want to talk a little bit before we get you out of here about how medical technology is implementing robots. Have you folks gotten some of that over at Conway Medical Center?
We absolutely have. Another area that we started in about the last year now. We've been in the robot business, and we actually have two. We have a what's called a Da Vinci robot, which is used a lot for general surgery, urology, and can also be used in gynecology services and gynecology surgery. And we're seeing a ton of success with that one. We also have a robot that is used in spine surgery. And yeah, absolutely. And we have that deployed now and is being used successfully in cases as well. It helps with just being able to guide the surgeon and help him or her be able to make the right placement for if you get screws or hardware or anything of that nature. And so that's something else we've been absolutely doing a lot of as well. So both of those have been very successful programs. And really what we've seen, especially with, I'll take for instance in the general surgery realm, we've seen patients have a lot less pain post-operatively after surgery, and they seem to be less debilitated. So they get back on their feet quicker. So that's a great thing. I know I was talking to one of my surgeons just the other day, and he's doing some things with the robot now, and he says, you know what? I don't even have to send patients home with pain medicine. Tylenol, ibuprofen, and they do fine.
Wow,
and,
that's awesome.
Which is truly amazing, especially in this day of, there's a lot more scrutiny around opioids and that kind of thing.
Right,
and so to be able to do that is quite remarkable. And that's not everyone, I get it. But we're seeing surgeries who normally had, a longer recovery time be much shorter, like hernia surgeries and this kind of thing. And so lots of success. So you're right, technology is really advancing. And at the new facility, we're going to be planning to be deploying the same technology.
Well, they've been doing that for a while. I had a hernia operation years ago. They had me up that afternoon.
Mm-hmm.
Oh,
really?
Man. Oh, yeah, buddy. I was crawling along the hallway there. It was something else, but I was home within a day.
Yep.
A day or so.
That's great.
Yeah, it's crazy.
Yep. And with the robot, you probably will have less pain just because it's able to, the surgical tools are so much smaller that you cause less tissue disruption, but you really just, as you're trying to take out, let's say, a gallbladder, it's just less traumatic to the patient using the robot than that non-way. Now, again, the robot's not for everyone because some people, depending on your case, it may not be the right choice for you. But if it is, and if you're a candidate, that is something that we are able to do. And that'll be, that's something that your surgeon decides when he or she's seeing you and, looking at your case and looking at your x-rays and that kind of thing.
Well, before we let you go,
Okay.
you got a couple of kids in college, or you got one in and one wanting to go.
That's correct.
And I got one that's, man, can you believe Tristan's going to be going to college
That's
in 3
insane.
years?
Yeah.
That's beyond me.
Oh, yeah.
The medical opportunities that exist in South Carolina, especially here in our area that didn't exist 20 years, might be a good field for kids to really consider getting into.
Absolutely.
It's been good to you.
It's I've been blessed. It's been good to me. And I would say right now, for students who are thinking about going into nursing or into medicine, there are a ton of opportunities. Right now, we're hiring nurses every day at Conway Medical Center. So nursing is a huge field of need for us. There are some other areas that are also very good as well, but those are two right off the top of my head. I mean, we've recruited right at almost 30 docs to Conway area since the beginning of the year.
That's
so
incredible.
we've actually had a banner recruitment year despite the COVID, but we're hiring nurses all the time. I mean, it truly is that field offers so much opportunity for anyone who wants to go into it.
And some great great opportunities to get your education even here in the county now.
Absolutely,
Just wants to point that
absolutely. Some great schools right here in Horry County that can train you up, and we love partnering with Coastal Carolina and with Horry Georgetown Tech, and have a lot of students who come over and do do either some of their training or shadow some of our providers, and so we like working with them, and excellent schools.
Best of luck with the certificate of need.
Thank you very much. Thank you very much. We're excited about it, and we're looking forward to being out there.
All right. Dr. Paul Richardson, Conway Medical Center. As always, we appreciate your support of the show and all you do in the community. Come on back.
Oh, yeah, appreciate the feedback too, Doc.
Yeah.
Thanks.
More River Talk in just a bit.
Thanks.